Hello, Rockland. Thank you for holding this rally in the heart of my congressional district. It's good to be back home. I'm here to tell you that my prediction will come true. By the end of this year, we will pass comprehensive health care for all, and President Obama will sign it into law. As part of that debate, we are also going to get, I've gotten a pledge from Speaker Nancy Pelosi that we will have a vote on the House floor up and down for single payer, which I'm for. Single payer would be the best thing for this country. It would essentially be Medicare plus for all. Everyone would be covered. There wouldn't be any problem. And health care is a basic right. Now, the bill that we are putting forth, H.R. 3200, which passed out of the committee on which I serve, the Energy and Commerce Committee and the Health Subcommittee, that is a bill that has a strong public option. And we've been hearing a lot of things, lies about public option. You know, before I tell you about public option, let me tell you, the insurance companies have been spending millions upon millions of dollars to team up with Republicans to try to deny health care for all. And you know, the insurance companies like it just the way it is. They set the premium and you have to pay it. They determine whether you are covered and you have to listen to them. If you appeal, who do you appeal to? You appeal to the insurance companies that denied you in the first place. I have just been speaking with a woman who needs drugs for cancer, which is life and death. She's in her early 50s. She's gone to many doctors, and they told her that the medication that she's been taking isn't working, and she needs to have other medication. Her health insurance company denied it to her because they said the drug was experimental and they didn't have to give it to her, even though these are the drugs that her doctors say she must have. So I'm fighting with her insurance company. Who is the insurance company to decide who lives or dies? Who is the insurance company to think that they can be God and decide who they're protecting or who they're not protecting? I'll tell you another story. I have Blue Cross Blue Shield. I get it as a federal employee. I pay about $500 a month for it. My kids are covered. When my daughter turned 22, they said, you know what? She's not covered anymore because she's turned 22. So I had to pay extra for her, and that was a premium of about $450 a month for one 22-year-old child. Again, Blue Cross Blue Shield. They reviewed my daughter's application. They said, sorry, we're going to deny it because my daughter was born with a heart murmur. It's very minor and doesn't affect her. They had the nerve to say she had a pre-existing condition. Now, pre-existing baloney, she was covered under Blue Cross Blue Shield from the time she was born. I fought them and I won. But how many people fight the insurance companies and they lose and they get sick and they die and all the insurance companies care about is the bottom line? That's wrong. It shouldn't happen in the United States of America in the 21st century. And the public option that so many people rant and rave about, it is what it is, a public option. The word option means you have the option of taking it. It doesn't mean that everything is public. And why do we need a public option? Because insurance companies like it the way it is right now. They compete against themselves. It's collusion. In 3/4 of the states of the United States, there's only one insurance company or maybe two. So they're in collusion and they jack up the rates. If you have a public option that has a premium that's low, insurance companies will have to keep their premiums low in order to compete. They don't want it, and that's why they're against the public option. That's why we're for it, and we're going to get it. So I just want to tell you that as your congressman, as someone who's on the Health Subcommittee, as someone who's on the Energy and Commerce Committee, as someone who's going to get on the floor of the House of Representatives and fight for single payer, I want to tell you that I'm going to be there every day fighting till this country has universal health care for all. People say, oh, it's 47 million Americans that are uninsured. What do I care about those people? As long as I'm insured, that's all I care about. Well, people who say that, I have news for you. It's not going to stay at 47 million. It's going to be 50, 60, 70, 80, and you're all going to be swept up in it. Because if you change your job or lose your job or there's other problems, you are not going to be insured because the current health care system is unsustainable. So it's not a matter of keep what I like. You won't have it, which is why we need universal coverage and health care reform now. So let me tell you, my friends, we're going to get it. Despite people who lie and have fears, despite people who don't care about anybody other than themselves, we are our brother's keepers. We're going to get health care. Our brothers are going to get it. Our sisters are going to get it. Health care for all. We're going to do it this year, under this Congress, under this president. God bless you and thank you. I'm proud to represent Rockland.